Thank you.
Thank you very much, everybody.
Dr. Ronel Soibam, he will be presenting on important OCT biomarkers.
Good morning, all. My presentation is on important OCT biomarkers. It is useful for diagnosis, measuring disease progression, or predicting and monitoring effects of therapeutic interventions, and it is great importance for individualizing the treatment. So OCT biomarkers is non-invasive, provide near histological assessment, and is very useful in assessing the functional outcomes. In this vitreomacular interface disorder, here you can see it can be divided in central bouquet abnormalities, which can be divided in OCT. You can see here the cotton ball sign appearance, and the second stage is the foveolar detachment, and the third one is the aqueous-betaliform lesion formation. Here, this cotton ball sign is nothing but this round, fuzzy, hyperreflective area between the inner segment ellipsoid joint and interdigitation joint. Here you can see this round fuzzy appearance. So next important biomarkers is the ectopic inner foveal layers, which is usually seen in epiretinal membrane in third and the fourth stage. Which is or hyperreflective bands extending from the inner nuclear layer and inner plexiform layer across the foveal area. So these two structures, first is the aqueous-betaliform lesions and ectopic inner foveal layers. These two structures, before the appearance of these two structures, this indicated that if you perform the surgeries before the appearance of these two structures, the structural as well as the functional improvement is complete. So some of the OCT biomarkers in uveitic disorders are the bacillary layer detachment. Here, this separation, you can see here in these OCT pictures, here the separation of inner segment of myoid joint from the inner segment of this separation, you can see, which is usually seen in Burkiaraki harada or toxoplasma chorioretinitis. And another OCT biomarkers for syphilis placoid is the acute loss of, you can see here in the syphilis placoid disease, here the loss of EZ and the thickening of the RPE, and with the nodular elevation here you can see the loss, which is completely resolved after the treatment. So another sign, which is Pitchfork sign. So it is the, you can see here the finger-like projections from the towards the outer retinal layers. Here, this is usually seen in syphilitic lesions, toxoplasmosis, tuberculosis lesion, and inflammatory CNBM, sometimes in inflammatory CNBM also. Another sign you can see here is the Rehnquist sign, which is first described by Invernizzi et al. In the patient with the endogenous Candida anophthalmitis. Here you can see the hyperreflective echoes in the retinal surface with the backscattering towards the choroidal side. Some of the OCT biomarkers in the disorder which are seen in drug toxicities are the flying saucer sign, which was first described by Chen et al. In hydroxychloroquine retinopathy. Here you can see in the perifoveal area the loss of EZ in the perifoveal area, and which is present in the EZ in the foveal area. So another OCT biomarkers, which we can see in the MAC inhibitors associated retinopathy, which is usually transient and self-limiting retinopathy, which can be of 4 types, the 4 distinct features which can see in these MAC inhibitors associated retinopathy. One is dome shape, one is caterpillar, like arrangement, and one is wavy-like arrangement, and then it's a splitting type, which is usually transient and self-limiting retinopathy. So OCT biomarker, which we can see in the neovascular AMD, can be divided into distributions of retinal fluid or structural arrangement. So in the distributions of retinal fluid, we have an intraretinal cystoid fluid arrangement and subretinal fluid and sub-RPA fluid. Here you can see this intraretinal fluid, which is usually the pro-prognostic sign, and subretinal fluid here you can see, and this sub-RPE fluid here you can see, this area, this sub-RPE fluid. So structural OCT biomarkers in AMD are the photoreceptor layer integrity. In this photograph of OCT, you can see here the disruptions of...
you have 1 minute to conclude.
Okay, sir. Which is prognostically very bad sign. And another finding is the hyperreflective dot in the which is related with activity and the lesions of its recurrence. So one important sign is the outer retinal tubulation, which was first described by Jevifil in 2009. It is a hyporeflective structure. Here you can see this is the outer retinal tubulation. Presence of this is usually the worst prognosis. And another is a subretinal hyperreflective material. Sometimes it is also known as subretinal hyperreflective exudate, which is located
in...
in...
You need to conclude now. Its time is up.
Yeah. So actually, take-home message is thorough understanding of these biomarkers is important because of their diagnostic and potential prognostic and predictive value. Thank you.
Thank you very much, sir. It is a very enlightening talk. So what would be the approximate time duration between stage 1, 2, 3, 4 of epiretinal membranes that you said? Approximate time durations for progression from one stage to the other. You said in stage 2, till stage 2, you have very good results.
Yeah, actually, around about 6 months to 1 year or something.
All right, okay. And in AMD, which you showed all the biomarkers, intraretinal, subretinal, sub-RP, which is the most critical fluid that you consider for repeat treatment?
The sub-RP one.
Okay, 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 okay.
Any other questions from the audience? Okay. Otherwise, thank you.